What's something people don't know about cancer? Even the healthiest among us can fall victim to it. Jimmy Carter, a beacon of health and vitality even in his 90s, announced his battle with melanoma, a stark reminder that cancer does not discriminate. It's a question that echoes in the hearts of many. Why do seemingly healthy individuals fall prey to this dreaded disease? The answer is not simple. The truth is, cancer is a complex and multifaceted adversary, a lottery where the odds, unfortunately, favor the house. It's a game of chance, influenced by countless factors. We tend to perceive cancer as a modern-day plague, a consequence of our increasingly polluted environment and unhealthy lifestyles. But this view is overly simplistic. But this is a misconception. Cancer is not just a product of our times. Cancer has plagued humanity for millennia. Its insidious presence documented in ancient texts and even etched into the bones of our ancestors. It's a part of our history. So, if cancer is not merely a product of modern living, why haven't we evolved to resist it? This question has puzzled scientists for generations. Why does this cellular rebellion persist across species and through the ages? The answer lies deep within our biology. The answers lie in the very fabric of our biology. The intricate dance between our genes, our environment, and the relentless march of time. It's a story written in our DNA, influenced by the world around us and the passage of time. I bet you didn't know that cancer has been haunting humanity since ancient times. Venture back in time to the dusty scrolls of ancient Egypt. Here, amongst hieroglyphs and incantations, we find descriptions of tumors, their relentless growth, and the often futile attempts to combat them. Cancer, it seems, has been a constant companion of humanity, a shadow lurking in the wings of our existence. Fast forward to the present day, and the battle against cancer rages on. We've made remarkable strides in understanding its complexities, developing sophisticated treatments that offer hope where once there was none. Yet, cancer remains a formidable foe, a leading cause of death worldwide. The persistence of cancer across millennia speaks to its insidious nature. It is a disease that exploits the very mechanisms that drive life itself, cell growth and replication. As our cells divide and multiply, errors can occur, mutations that can set them on a path towards uncontrolled proliferation. Are you surprised to learn that the very process that allows us to live longer also makes us more vulnerable to diseases like cancer? Evolution, in its relentless pursuit of survival, has favored traits that ensure the propagation of our species. We are programmed to reproduce, to pass on our genes to the next generation. But beyond this prime directive, evolution cares little for our long-term well-being, and so we age. Our cells accumulate damage, their repair mechanisms falter, and the risk of errors, including those that lead to cancer, increases. This is the paradox of longevity. The longer we live, the more susceptible we become to this cellular rebellion. But why haven't we evolved more robust mechanisms to prevent or repair these errors? The answer likely lies in the balance between cost and benefit. Dedicating precious resources to maintaining cellular integrity indefinitely may come at the expense of other essential functions, such as growth and reproduction. This is going to blow your mind. Elephants, those majestic giants, possess a remarkable secret. They rarely get cancer. Despite their immense size and long lifespans, these creatures have evolved an ingenious defense against this cellular insurgency. The key lies in their genes, specifically in the presence of multiple copies of a gene called TP53. This gene, often dubbed the guardian of the genome, plays a crucial role in preventing cancer. It acts as a molecular watchdog, identifying and eliminating cells with damaged DNA before they can run amok. While humans possess a single copy of TP53, elephants boast a staggering 20 copies, providing them with an army of cellular guardians. The elephant's resistance to cancer highlights the intricate connection between our genes and our susceptibility to this disease. It underscores the power of evolution to shape our biology, for better or for worse. This is going to blow your mind. Section 5, Nature versus Nurture, unraveling the cancer code. Is cancer a consequence of our genes, a blueprint for disaster etched into our DNA, or is it a product of our environment, a toxic cocktail of carcinogens and unhealthy habits? The answer, as with most things in biology, is complex and nuanced. It's a bit of both. Our genes undoubtedly play a role, influencing our susceptibility to certain types of cancer. Inherited mutations can predispose individuals to developing the disease, passing down a legacy of vulnerability. But genes are not destiny. Environmental factors such as exposure to tobacco smoke, UV radiation, and certain chemicals can also trigger the genetic mutations that lead to cancer. Lifestyle choices such as diet, exercise, and alcohol consumption can further tip the scales, influencing our overall cancer risk. If you found this information valuable, don't forget to subscribe, like, and share this video. Let's spread awareness together. You need to watch this if you struggle with understanding cancer myths. Section 6. Debunking the myths, separating fact from fiction. Cancer, shrouded in fear and misunderstanding, has become fertile ground for myths and misconceptions. These myths can lead to unnecessary anxiety and even hinder effective treatment. One pervasive myth is that sugar feeds cancer, implying that eliminating this sweet treat from our diets can starve the disease. This misconception can lead to overly restrictive diets that may not be beneficial. While a healthy diet is crucial for overall well-being, sugar does not specifically fuel cancer cells. It's important to focus on balanced nutrition rather than eliminating specific foods. Another misconception is that cancer is a death sentence, a diagnosis with no hope of reprieve. This belief can cause despair and prevent people from seeking timely medical help. While cancer remains a serious disease, advancements in treatment have dramatically improved survival rates for many types of cancer. Modern therapies and early detection have made a significant impact. Early detection and timely intervention can make all the difference. Regular screenings and being aware of the symptoms are key to catching cancer early. It's essential to separate fact from fiction, to empower ourselves with accurate information about this disease. Knowledge is a powerful tool in the fight against cancer. By understanding the science behind cancer, we can make informed decisions about our health and advocate for research and policies that support prevention, early detection, and effective treatment. Together, we can dispel myths and focus on facts to improve outcomes for everyone. Why are there not more people talking about the unequal burden of cancer? Cancer is a global crisis, touching the lives of millions worldwide. However, the burden of this disease is not evenly distributed. Disparities in access to healthcare, screening, and treatment have created a stark divide, with low and middle-income countries bearing a disproportionate share of the cancer burden. Lung cancer, for example, claims the lives of millions each year, with a significant majority of these deaths occurring in developing nations. This disparity is largely attributed to higher rates of smoking, limited access to smoking cessation programs, and inadequate screening and treatment facilities. Addressing these inequities is crucial to mitigating the global impact of cancer. Strengthening healthcare infrastructure, improving access to essential medicines, and promoting cancer awareness and prevention programs are all essential steps towards a more equitable future. This is going to blow your mind. On the cusp of a cure AI and the future of cancer treatment, the fight against cancer is entering a new era, one marked by groundbreaking discoveries and technological advancements that offer unprecedented hope. Artificial intelligence, with its ability to analyze vast data sets and identify patterns, is emerging as a powerful tool in our arsenal. AI algorithms are being trained to detect cancer earlier and more accurately than ever before, analyzing medical images and identifying subtle signs of the disease that might escape the human eye. Machine learning models are helping to personalize treatment plans, predicting patient responses to different therapies and optimizing treatment outcomes. The potential of AI in cancer research is vast. From accelerating drug discovery to developing novel immunotherapies, AI is poised to revolutionize our approach to this complex disease, paving the way for more effective, targeted, and personalized treatments. You need to hear this if you're determined to fight cancer. Section 9. Empowering ourselves, prevention, hope, and the quest for a cure. While the fight against cancer continues, we are not powerless in the face of this formidable foe. Each of us has a role to play in this battle, and together we can make a significant impact. We can take proactive steps to reduce our risk, advocate for research, and support those affected by this disease. By coming together as a community, we amplify our efforts and create a stronger front against cancer. Prevention, after all, is the most potent weapon in our arsenal. It empowers us to take control of our health and make informed decisions. By adopting healthy lifestyle choices, such as maintaining a balanced diet rich in fruits and vegetables, engaging in regular physical activity, whether it's jogging, working out at the gym, or practicing yoga, and avoiding tobacco smoke and excessive alcohol consumption, we can take significant strides in reducing our cancer risk. These lifestyle changes, combined with regular health checkups, can make a profound difference. Regular screenings and early detection are also crucial, as they allow for timely intervention and significantly improve treatment outcomes. Early diagnosis discussions with healthcare professionals can provide clarity and direction, ensuring that any signs of cancer are caught early. The quest for a cure continues, fueled by the tireless efforts of researchers, clinicians, and advocates worldwide. Their dedication and hard work bring us hope and drive progress. With each passing day, we inch closer to unraveling the complexities of cancer, armed with knowledge, innovation, and an unwavering determination to conquer this disease once and for all. Together, we can make a difference and bring hope to future generations. Thank you for watching. If you found this video helpful, please subscribe to our channel, like this video, and share it with your friends and family. Together, we can spread awareness and hope.